Let's talk about big data, supercomputers, artificial intelligence. Now, as a doctor, you might be more aware of this innovation compared to people in other roles. We are curious to learn what the next big thing is, and how will artificial intelligence, or AI, how will it revolutionize the way you work in orthopedics, in obstetrics, in cardiology, in oncology? My guest today is Bill Fox of Samba Nova Systems in the US. Hi, Bill.
How are you, Chris?
I'm good, thank you. So health is one of your divisions at Samba Nova Systems. Now, it's probably going to be hard to explain in a couple of seconds or minutes what Samba Nova Systems stands for, but let's give it a try, right? So what are you guys doing?
So what we do is accelerate AI. What happened was, as AI came to the fore, legacy technologies were adapted to run AI workloads. And AI workloads are fundamentally different than the traditional transactional workloads that were run on old kinds of chips. So our founders, who both teach at Stanford and have had for a lot of success with companies in the past, decided that they were going to build the first platform actually built to run AI workloads and AI compute.
So what we're talking about here is new platforms, new hardware. Is this what is generally called supercomputers?
So supercomputers have existed for a long time. They can be roomfuls and roomfuls and roomfuls and warehouses full of stacks and racks and things. But all those traditional supercomputers were built on traditional chips, first CPUs and then GPUs. What we're doing is accelerating even those supercomputers by having new hardware and new software specifically designed for AI workloads. And even some organizations like in the United States, where it's a few of the national laboratories that have massive supercomputers, they're still getting tremendous acceleration from the new hardware and software.
Yeah. So the promise is that we will get better and faster hardware and software. Now, we're very curious, obviously, what that will mean for the health industry. On your website, Samba Nova Systems talks about the next generation of computing and, of course, artificial intelligence in healthcare. What will that future of medicine look like once you realize your full potential with the business?
Yeah, I think there's so many things we could talk about, but just to pick two sort of quickly, one is around medical imaging. Currently, high resolution images, really accurate images, are downsampled and what's called tiled out. So they're broken up into pieces so that they can be looked at on these legacy technologies that don't have enough memory to hold the whole image. On our system, we can use those whole images for training and inference for much more accurate potential diagnostics and treatment and drug development. So that's on the medical imaging side. Also on the language side.
Can I ask one extra question on that, Bill? When you talk about medical imaging, does that mean we'll have much sharper images, that our doctors, specialists will be looking at much more detailed imagery? Is that what the end result will feel like?
Yes. Yeah, in essence, if you're training an AI model to, say, detect diabetic retinopathy or disseminate between a tumor that is cancerous and isn't cancerous, you'll be able to use much higher resolution images to train that model and then do more accurate inference so that the AI can do a much better job of doing those diagnostics.
Great, excellent. And then, obviously, you were going to unveil some of the other innovative uses of artificial intelligence.
Right. So AI is growing so quickly. A big language model, a big natural language processing model 3 years ago had 100 million parameters. A large natural language processing model now has 150 billion parameters. That happened in 3 years. And there are already much larger NLP models than that. That's not that interesting in and of itself, except that in natural language processing, the larger the model is, the more accurate it is.
And
And some
just
of the
pardon me
famous
to ask,
models, like,
natural language programming, I'm afraid you'll have to explain that a little bit more. I know
sure.
our viewers are very intelligent, but that might be very, very specialized. What is that? What does that
Yeah,
mean in
and
this
it's
context?
not complicated. It means models that can understand language. So if you think about the unstructured language in an electronic health record, the notes that the doctor's actually taking that aren't in structured fields, the ability to feed that in to an AI system, have that AI system read it, summarize it, and really understand it more and more and more and more accurately, so that can feed clinical decision systems, doing analytics, figuring out, using social determinants of health data and real world evidence data that's not in structured fields. And the larger the models are, the more accurately that can be done to assist the caregiver.
Yeah. I also read that another area you and your team work on is telehealth, virtual care. What's new there?
Yeah, so interestingly, that this sort of trope during the pandemic was that telehealth was advanced 5 years in 6 months. And that's not really what happened. What really happened was existing technologies were thrown together, to tremendous effect to be able to have people communicate virtually with their doctors when they couldn't go to their doctor. Now we have the opportunity to, if you're calling and you're describing symptoms, then an AI can be doing that initial triage of that diagnosis and getting you to the right caregiver, the right kind of specialist doctor. If you are then want to use real conversational AI instead of a dumb chatbot, that can be developed on these larger language models, virtual diagnoses. So all these pieces of telehealth can be brought into, version 1 to version 5 by using these advanced AI solutions.
I hear you talk about larger models, better platforms, this innovative new technology. That's obviously what your business is working on. How long before all this great new technology is available around the corner in a medical center, for example?
Yeah, I think that that's going to be an interesting evolution. I think what will probably happen is there will be a lot of niche and specialist AI companies that address certain parts of the healthcare market, and specialist physicians and physician practices will be able to access that.
Does that
So
mean
possibly sending out to a much larger organization to be able to help read those, or access an API from a large healthcare tech company to do something. So I don't think this is something that for a long time a 5-person medical practice is going to be using GPT to analyze their electronic health records. But there may be a service that is using that can help them, say they're in a visit with a patient, and that visit can be virtually transcribed while it's happening so that they don't have to take notes, and then summarized. And then all they need to do is look at it and make sure it's accurate and put it in the EHR. That could save them 5-10 minutes a visit over the course of a 25 visit day. That's a lot more time, to actually spend with the patient and be empathetic and do the things that humans do better.
Yeah. I think we can all see the benefits, especially doctors, specialists working in their practice. Now, your title says business development. So tell us about funding. How does this work? Who's going to fund these massive investments that I believe are necessary to make this flourish?
Yeah, I think, luckily, we are the highest funded AI startup in the world. So we have a lot of funding to work on the actual hardware and the platform and the software and the stack. And we are actually offering what we do as a service. So we've tried to cut down on that giant initial investment by offering it as a subscription so that you can do that as an OpEx and it's not quite that sort of that big initial investment. Still in all, I think it's going to be kind of a trickle down effect. The big pharmas, the largest healthcare systems, national healthcare systems are going to be the ones that are going to drive this and fuel and pay for this innovation. And then that tends to very quickly disseminate once we get there. So I do think it will start with the larger organizations, government healthcare, large organizations in the United States, top 20 pharmas. They're going to invest in this, and then we'll see those effects trickle down. And plus, the technology, of course, increasingly gets less expensive and better as time goes forward.
Yes. So just out of curiosity, Bill, is anything moving on our side of the planet here in Australia?
Yeah, I mean, we have an APAC group, and we absolutely are talking to organizations literally all over the world. I just came back from Basel. We were just in Dubai. All we need is the interest, and we're there. And I have talked to health authorities in Australia and some of the other jobs I've had before this one, and no doubt we'll get there. But yeah, definitely things are moving in that part of the world.
Fantastic. Now, from all these areas, and you've only mentioned a few, I'm aware of that. So what for you personally is the most exciting innovation that just makes you get out of bed in the morning?
Yeah, to me, I have to split it between the imaging and the language, because there's a possibility, there's a capability now to really change the patient journey in a completely different way. Everything is so manual, so clunky, so difficult to get through, because it's a very one-to-one, person-to-person kind of transaction. And if we can take a lot of that out and have the ability for that patient journey and that patient experience to be vastly improved by AI, that will help with adherence to the drug you're prescribed and following up with the doctor. Because what happens is when you try to make that appointment and it's with the wrong doctor at the wrong place, or they don't take the insurance in countries where we don't have government, as much government insurance, things like that, people drop out of the system. And then on the other side, it's already very clear that through high-level computer vision, we think of it as sort of a just better. But in countries like India, where they're 60,000 ophthalmologists short of the number needed to serve their 1.3 billion person population, this could be the difference between hundreds of millions of people getting screened for something like diabetic retinopathy and not getting screened. So there's huge advances to be made, both in terms of patient experience and diagnostics and access.
That all sounds very promising, Bill. So these are, as you've pointed out, somehow mid-long-term projects. What does tomorrow look like for you in terms of making this go forward?
Really what we look for is innovative champions with inside organizations that have been trying to do digital transformation, really change a business process that's antiquated, and use AI to do that, and then work with them to get that project over the line. Currently, most AI projects sort of die in the science experiment stage or the POC stage. And one of the things that we're really trying to address is to make that implementation, organizations don't want to become AI companies. They don't want to compete for that talent and hire all the data scientists and all the AI ML engineers and figure all that out. So what we're trying to do is say, don't do that. Tell us what you're trying to do, and we'll deliver that capability as a service. And you just have a few people that run that and start training the data, start getting this stuff into production.
Fantastic. Well, I'm confident, Bill, that some of our viewers will at least, it will have triggered their curiosity, and some of them might even get in touch to form a partnership and to start working with you on that. We wish you all the best. Keep us informed. We'll follow you. We'll see you on the news when all these things start coming through. Thank you for clarifying all that, and all the best to you in your role, and all the best to Samba Nova Systems.
Thank you, Chris. It was a pleasure.